Ms. Wells is a pleasant 28-year-old African-American woman with a past medical history of asthma who presents to the office today with complaints of increased asthma symptoms after a near asthma attack that occurred 2 days ago. She reports shortness of breath, wheezing, dyspnea on exertion, a dry, non-productive cough, and orthopnea. She reports being at her cousin's house and being exposed to a cat, which is a trigger for her asthma. At the time of the asthma attack onset, she reported her wheezing being a 6 out of 10 severity and her shortness of breath was an 8 out of 10 severity. At the time of the asthma attack, she reports using her albuterol inhaler that decreased her symptoms at the time, but they did not fully resolve. Since the asthma attack 2 days ago, she reports 10 episodes of wheezing and has shortness of breath about every 4 hours, as well as waking up twice per night with shortness of breath. Her last episode of shortness of breath was this morning prior to arrival in the office. The patient reports her asthma symptoms as starting to interfere with her daily activities, and she is concerned that her albuterol inhaler seems to be less effective than it has been previously. At this time, the patient reports her breathing as normal. The patient has a past medical history of asthma. She was diagnosed at 2.5 years old. She reports being hospitalized five times for her asthma, with the last hospitalization being at age 16. She denies having to be intubated for asthma. She also does not have a current pulmonologist or allergist. She's currently taking an albuterol inhaler to manage her asthma symptoms. She is not aware of any environmental exposures or irritants at her job or home. She denies current use of tobacco, alcohol, or any illicit drugs. She does report smoking marijuana for about 5 to 6 years, and her last use was at age 21. She denies any exercise throughout the week. She's alert and oriented and sitting upright on the exam table. She maintained eye contact throughout the interview and exam. No acute distress was noted. Her chest expansion is symmetrical with respirations. Normal from it is symmetric bilaterally. Chest resonant to percussion. No dullness. Bilateral expiratory wheezes were noted in posterior lobes. Bilateral muffled words with notable expiratory wheezes in posterior lobes were also noted, and there were no crackles. In the office, her spirometry readings read as her FVC 3.91 liters. Her FEV1 FVC ratio was 80.56%, and her oxygen on room air was 97%. Based on the history and exam of this patient, she has moderate persistent asthma. The plan for this patient will be to manage her with an inhaled steroid and a long-acting bronchodilator, and have her continue her albuterol as a rescue inhaler as needed. A combination of inhaled steroids and a long-acting beta-2 agonist will provide improved control of the patient's asthma symptoms and work for a maintenance treatment for her asthma. Therefore, I would prescribe fluticasone salmeterol, so the Advair Discus or Advair HFA, 2 inhalations PO twice a day. Due to the severity of her asthma, I would probably put her on the max dose. I would then provide the patient with some medication instructions, such as inhalation should be 12 hours apart. If shortness of breath happens between the administration time periods, use 2 puffs of her albuterol inhaler. I would also instruct her to rinse her mouth after using any inhaler. I would go over side effects that may happen with this medication, such as throat irritation, headache, nausea, vomiting, or tachycardia. I would then go over some patient education points with her. I would advise the patient to avoid triggers and possible exposure to triggers such as cats. I would reinforce symptom recognition so she knows when to use her albuterol inhaler. I would ensure the patient had an asthma action plan, and if not, create one with her. I would also emphasize the importance of regular physical activity and maintaining a healthy lifestyle. I would advise her to go to the emergency room for any severe asthma symptoms such as severe shortness of breath, chest tightness, and difficulty breathing. I would have the patient follow up within about a month to assess how the new medications are working. And lastly, I would see if the patient had any questions with this plan of care.